Acupuncture is the ancient Chinese practice of inserting very thin needles at specific points into the body to promote balance and restore the natural flow of energy through the body. It is often used to relieve pain and encourage healing. Although not all studies of acupuncture agree, some studies show that women who receive acupuncture in combination with fertility treatments, such as in vitro fertilization and intrauterine insemination, can increase their chance for a successful conception and pregnancy. Proponents of acupuncture believe that it can help improve conditions that affect fertility, such as polycystic ovary syndrome, fibroids, and endometriosis. Other benefits may include reducing side effects from fertility medications, such as bloating and nausea, and reducing stress and its effects on fertility. Practitioners of acupuncture commonly recommend starting acupuncture at least 3 months before fertility treatments, such as IVF or IUI, in order to produce optimal effects. Most acupuncture sessions last about 1 hour and occur 1 to 3 times per week. In general, the needles for acupuncture are very thin and disposable. That means that there is very low chance of infection from the needles, and most patients don't even feel them being placed. Some patients may notice increased and looser bowel movements while using acupuncture. Like any other individual you let manipulate your body, an acupuncturist should be licensed, registered, or certified to practice acupuncture. 2 major certifying organizations are the National Certification Commission for Acupuncture and Oriental Medicine and the American Board of Medical Acupuncture. At Genesis, we work closely with experienced and licensed acupuncturists and offer on-site appointments for our patients. With multiple fertility centers in the New York City area, Genesis serves patients from Brooklyn, Staten Island, Long Island, and Lower Manhattan, New York. For more information or to make an appointment, please visit genesisfertility.com.